McClymont House is a care home for older people in Lanark. It's run by South Lanarkshire Council. We cater for 27 residents, 25 are long term and 2 beds we use for respite for people in the local community.
I enjoy being here. I like everything about it. The food is lovely. The staff treats me lovely. I thought I would like living alone, but it was too lonely in my own big house. Far too lonely. Where here, I've got company all day. There's always something happening, and my family can visit me at any time. So this is a wonderful place.
My role as the manager within McClymont House is basically to try to keep everybody happy, try to promote everyone's choices and any decisions they want to do within their life. As part of the vision of integration within South Lanarkshire, it's vitally important that all residents are put at the heart of all decisions made. Recently we were interviewing for a social care worker, and we had a lady who was 100 years old and another lady who was 97 helping with the interview process. They were very enthusiastic and thoroughly enjoyed the experience, and they loved the opportunity of being an advocate for their fellow residents. But for a bit of fun, we decided to do it apprentice style, which the residents thoroughly enjoyed because they watched the television programme.
The residents on the panel gave me a great appreciation of the role of the social care worker. They know what they're looking for somebody to care for them. It's okay, it's like a manager choosing the staff, but the resident taking part, and they know what they're looking for individually, so it does make it a wee bit more difficult.
Well, I've asked various things. I asked her what she was capable of doing, and I asked her if she had patience. I think that's one of the most important things in this place, to have patience with the people. I really do enjoy these interviews. I really enjoy them and doing them.
It's an important job, but it's great fun, and I love to hear the residents asking questions and having answers clarified. And I learn a lot from older people. We have people in their 90s and over 100 who've lived very busy lives, very sort of responsible roles in their previous employment. And I've still learned to this day from their experiences, and it helps me do my job.
I suppose the principle here is that if you're the person receiving the service, you're in a very good position to comment on how good that service is and what the qualities are and the staff you'd like to support you. So this idea of involving residents in the decision making around the employment of staff is very straightforward and aligns very, very well with the idea that co-production, involving, engaging, listening to the service user and their families is actually the best way to do this.
It was useful for me because it gave me an opportunity to see the candidates coming for interview interacting with service users, the people they would be caring for. And that was very important for me to see that they had natural caring skills and were comfortable interacting with older people. And I think that's really important in the job we do, whether you're the care home manager, whether you're cooking, caring or cleaning within the care home. It's really important that we have a rapport with service users.
The interview panel, they were great, and when I came out in my interview, I was really unsure.
You're hired!
When I got told that I was hired, I was ecstatic. I really was. It was a great feeling.
Traditionally, we've been used to agencies listening to themselves, and we haven't really been consulting with service users and acting on their wishes. I think very much now the culture has changed, that service users do drive agencies and all kinds of service providers.
As the work goes on in relation to how we provide support in people's homes, residential care, nursing home care, then over the years what you've seen is closer alignment of the way in which we work together, joint training, sharing an ethos of an approach that should be taken. And as people's needs have grown more complex, and I think particularly around a sensitive issue like end-of-life care, then that has to be done together. There is no other way in working alongside a family and the individual to try and get that right. And certainly I've found over the last 5 years I've received lots of compliments about the service, whether it's health or social care, or importantly together, about how well we're actually able to do that, and do that in a very dignified way for the family and individual.
Well, it's been an experience, hasn't it? Something new in my life.